Head and neck anatomy. Introduction. As a dental assistant, we need to be familiar with landmarks of the oral cavity. Landmarks of the face, the owl of the nose, labial, nasolabial groove, philtrum, vermilion border, vermilion zone, tubercular of the lips, labial commissioners, and labial grooves. And if you notice in some of these areas, here's the owl of the nose, the tragus of the ear, the inter-outer canthus, and then landmarks of the lips, vermilion border, the vermilion zone, the philtrum, the oral commissioners. Landmarks of the oral cavity includes vestibule, labial mucosa, buccal mucosa, Stetson duct, salivary glands, linea alba, alveolar mucosa, gingiva, labiophrenium, and buccal frenum. The attached gingiva, the labiophreniums, mandibular vestibule, mandibular buccal frenum. And here's some more. The uvula, the soft palate, palatine tonsil, the retromolar pad, free gingiva, the labiophrenium, anterior pillar fossils, maxillary tuberosity. Then we have saliva glands. There's parotid gland, submandibular gland, sublingual gland, and there's glands and ducts also. Right here is the Stetson duct and the Wharton's duct in the submandibular gland, parotid gland. Linea alba is a white line that runs horizontally across the cheek. Some people have a strong linea alba, some people don't have it much at all. You can't even see it. On the palate, we have a soft palate, uvula, the hard palate, incisor papilla, palatine raphe, and palatine rugae. The raphe is the line that goes from the uvula through the midline, and the palatine rugae are the vertical folds on the hard palate. We have the hard palate and the soft palate. On the tongue, there's many landmarks that we want to pay attention to, and here are some of the ones we need to know are the dorsum of the tongue, which is the top, the ventral surface, the tip of the tongue, the circumferential papilla, and the base of the tongue. The tongue is attached to the floor of the mouth by the lingual frenum. It helps with the functions of the speech, swallowing and tasting, and different portions of the tongue have different taste buds. The saliva glands, which we saw earlier, parotid gland, and the duct is a canal where the pathway of the fluid, the Stetson duct, carries saliva from the parotid gland. Saliva aids in mastication and lubricates food. The lack of saliva increases the incidence of caries. Xerostoma refers to as dry mouth. Temporomandibular joint is a hinge joint. It's formed by the articulation of the mandibular bone and the temporal bone. And then they come together at the TMJ, temporomandibular joint. Causes of TMJ disorder. You may have people say that they have TMJ. Everyone has a PMJ, but the disorders are bruxism, which means grinding, displaced or dislocated disc, or trauma. Treatment for the TMJ disorders: short-term non-steroidal anti-inflammatory drugs for muscle relaxants, a night guard, or possible surgery. Muscles of the head and neck. Each muscle has an origin, which refers to a fixed point, and it's inserted in a movable point. The muscles of mastication is the temporal, largest muscle of mastication, masseter, the strongest, and pterygoid. Muscles of the facial expressions, orbicularis oris, which opens the lips, buccinator, compresses the cheeks. Muscles of the tongue is genioglossia. If you think of anything that says glossia, it refers to the tongue. It does the work of the tongue. It protrudes and retracts. Hypoglossia depresses. The muscles of the floor of the tongue, digastric, assists in the opening of the mouth, and myloid hyoid forms the floor of the mouth and depresses the mandibular elevation of the tongue. Muscles of the neck, trapezius, moves the head backwards and laterally. The sternocleidomastoid assists in the elevation of the chin. The nerve of the neck is trigeminal, the largest cranial nerve, inverts from the maxillary to the mandibular. And these are 3 of the transmittal nerves. If a doctor was going to do a composite on tooth number 30, what nerve would the doctor be anesthetizing? And that would be the mandibular branch. Arteries of the face and oral cavity, there's the carotid that supplies blood to most of the head and neck. Intercarotid supplies the blood to the brain and eyes, and external carotid that supplies the blood to the face and the oral cavity. Veins of the face, there's the jugular external and internal. The external drains the superficial veins from the face and neck to the subclavian vein, and the interjugular receives blood from the cranial face, neck, and drains into the bronchial cephalic vein that is in the superior ventral cava, which drains into the heart. So that's it.